COVID-19 recovery, helping Hoosiers recover financially, physically, mentally, and socially through services provided by Community Action of Greater Indianapolis. Services include energy assistance, child care, family support, education, training programs, transitional housing, and food assistance. COVID-19 recovery.
Hi, I'm Terrence White of Community Action of Greater Indianapolis.
And I'm Kelly Vaughn here at WHMB TV 40, and this is COVID-19 recovery, where we're here to help you recover from this pandemic. And you have a very special guest joining us for today's show to talk about solutions, help that's out there for the community.
Yeah, one of the things that Community Action is doing is we are subawarding grants to other organizations doing the work out in the community. One of the key areas of focus is employment recovery, training, workforce development, job placement. And so today we have a special guest, Demetrius Bruno of Redemption Outreach Services, Inc., or Rossi, who's going to share with us some of the things that she's been doing with her organization.
Hi, Demetrius.
Hello, thank you guys for having me. I appreciate it.
All right.
Yeah, excited to be here.
So what is
So
Redemption
basically-
Outreach Services?
Okay, so we're a nonprofit organization and a 501c3, of course. Our basic premise and focus is on helping to infuse or support for growth socially as well as economically. So we focus on youth, young adults, 18 to 24 years of age, and helping them to become more self-sufficient, more valuable in the workforce, if you will. And so our basic premise is to do the job certification, credential building piece that allow people to be more, as I said, valuable in the workforce. So that comes into play with what we're all dealing with the effects of COVID-19 and how that's been detrimental to the financial state of a lot of people in our communities. So that brought us together to kind of collaborate on this initiative. So it wasn't anything too far different from the way our programs are established from the beginning. But with the support that we've received in this partnership, it does allow us to do a whole lot more with our training components. That would be making it hybrid, online, which is more safe, if you will, during this pandemic period. So we were able to do some upgrades where it would be useful and effective with what we're facing right now. So, and then to stay true to what we're doing, the customer service call center simulation certification training, which we've already had, turns out to be one of the most valuable components in the workforce. Saying that because they were able to kind of switch up and work from home and do some things that were relevant into sustaining them as far as employment wise during this pandemic, where a lot of places were shutting down and, susceptible to the virus in itself for being in public space or community spaces like the workplace. So we're happy to have gained that support and was able to kind of, pivot and do some adjustments that made a difference. So we're pretty happy with that initiative. Another thing is with the collaboration, the case management support that comes into play with community actions part of it, kind of allow us to have the jobs in-house, but then we're seeing where they're coming in looking for a job already. So your bills are still, piling up. You still have your rent and things of that nature to maintain. And then parts of our training is unpaid. So where they've really been able to allow us to be really effective in the job placement side of things is allowing them to get the rental support that kind of takes the edge off from, transitioning into a new position without the baggage that comes along with being past due on rent, at least. So that's been a key component to the partnership. So I'm really, really excited about what we're able to do with this program.
Okay. You mentioned 18 to 24-year-olds, so that's primarily who you deal with, you're saying?
That's our ideal target, but we do deal with any age group.
Okay, okay. So what is the state of our young people through this pandemic? Because in a lot of ways, as far as the disease itself has affected the elderly, but how has it impacted the young folk?
Well, it's almost the same thing. We've had instances where they were signed up for training and then they had symptoms, and that kind of, interrupt that process for allowing them to uh, go and quarantine and, do the time away. So it's just prolonging the process. It's still the same scenario. I think nobody is any more susceptible to the detriment of this virus. So it's a bunch of the same. Just
Okay,
having symptoms, not knowing if you have it, being off from work, and it's just a vicious cycle. So we're just trying to stay effective in what we're doing here and allowing that process to go through. So
okay.
With dealing
same deal.
with dealing with the younger people, do you see that there are opportunities or advantages of training them in the customer service now that organizations or companies are transitioning to home-based offices? Do you view that as a benefit of providing this training to train them to work independently?
I think it's a huge benefit. The reason I say that is sometimes with older people, like we've had instances where maybe they worked in warehouse before, or they just have this certain uh, employment path that they've taken, and then try to dismantle that and teach a new skill or a new way of thinking. It's been, you know, problematic from a standpoint of them just being willing to learn new things. But with youth and the millennials, they're a little more flexible. You don't have a lot of previous work history, so you're able to kind of train them, in the way that they should go, if you will. And so, yeah, I'm finding that that's always been our niche because hold and develop a clear career path. So with youth, I'm just finding it a little more, they're a little more willing because they're just learning new things and not having to rethink or relearn from previous work history. So yeah, it's very beneficial, I think, to have a younger demographic that we're catering to at this point.
So if there's somebody out there who, they've been hit by the pandemic, especially when it comes to, their job or their financial situation, how can you help them, and how can they get involved with your with what you're offering?
Okay, so we do have the customer service call center certification. So the actual jobs are entry level, so you can come in not having worked in this field before and receive the initial training on the front end and then transition into a position, or you can come with previous experience. So that's going to kind of determine where your pay rate is. But I think we're definitely offering some competitive wages even for the entry level side. So basically, you would contact us and we'll do a needs assessment to see what that looks like for you, what your previous experience has been. If you do need that training component, of course, we once again have that support. Do you need the case management stuff to make this transition into this new position a little more comfortable for you? That's when we're working with the community partnerships that is obviously developed through Community Action at this point, being one of our main supporters of that program. So you call me, we schedule a needs assessment, you come in, we'll fill out the application and other pertinent documentation. Then we'll start from there. So at this point, we're enrolling probably every 4 to 6 weeks new classes. But if you come in with previous experience, we do have a shorter version of the certification to get you working a little sooner. But you would contact our office, and the magic begins from there.
Okay, well, it sounds good to me. Well, we appreciate you coming on and just making people aware of what's available, because that's what we're about, helping people to recover the COVID-19 pandemic. Thank you so much.
Thank you.
Demetrius Bruno.
Thank you. You guys have a great afternoon.
You do the
Okay,
same.
you too.
Thank you.
And when we come back, we'll have more on how to recover from this pandemic by what's happening in the world of vaccinations when we come back.
During the COVID-19 emergency, community action agencies are open and here to ensure the well-being of families across the country. For over 50 years, we've been delivering life-changing services, solutions, and stability.
Contact your local community action agency serving Boone, Hamilton, Hendricks, and Marion counties for help during the COVID-19 emergency. We can assist with masks, hand sanitizers, food, shelter, transportation, and more. Apply today.
COVID-19 has changed how we express our faith and gather to worship.
We all want to get back to how we pray,
how we congregate, how we lift our voices in praise. Now it's time to take the first step that lets us get back to spreading the word without spreading concern.
before we can safely come together, we need the facts.
As COVID-19 vaccines become available, you may have questions.
Should I get it?
Is it safe?
Should I wait?
It's okay to have questions. Now get the facts. Learn more at getvaccineanswers.org so you can make an informed decision when vaccines are available to you.
Hi, I'm Terrence White of Community Action of Greater Indianapolis.
And I'm Kelly Vaughn of WHMB TV 40. And, you and I both have our vaccines, have had our vaccinations, but, it makes you wonder. Of course, it was simple for us. I don't have any major health issues. I don't know if you do, but it was just kind of like, just go in there and get it done. But it makes you wonder, is everybody?
Right, it's not as simple for everyone else. And I think one of the main questions that people have is, when can they go get signed up to get this vaccine? And I think they are looking for a little bit of comfort in knowing that it's okay. So,
And a lot of questions out there, and we have somebody joining us today with a lot of answers, and she is Marjorie Duarte Sheffield, and you are a health educator, Healthy Homes, Environmental Consumer Management, and Senior Care. Welcome to COVID-19 Recovery.
Thank you for the invitation. I'm very happy to be here with you speaking about this very, very difficult subject, because we all know this pandemic has been around and possible is going to stick for a little while. Therefore, we have to work with the community and with this pandemic to try to drive it away. We need to do it. You and I and everybody that is involved, we have to work hard and helping the community.
I like that. It does take work. And don't be passive about it. So one of the things that we need to get done is getting our vaccinations. So, and as Terrence and I mentioned, I don't really have any major health concerns. So, but what about people who do have challenges? What about people who are diabetic or somebody who's on dialysis? Who can and who should get their vaccination?
First of all, People that is right now 50 years old should get vaccinated. That is the age right now. But we know that it's going to be lowering very soon. So be aware of that. Everybody in the range should get vaccinated. But people that, like the one that you mentioned, they should get also vaccinated in despite of their age. They have to talk to their doctors first. I'm not a physician, but I know that people with diabetes, uh, Down syndrome, or other people like people that have HIV, cancer, they should get their vaccine. Ask your physician, ask your primary care doctor, and they can clarify that to you. But please, everybody should get the vaccine. Go ahead and take it because this is for you. This is for all of us. And if we want to go to the normal that we knew a year ago tomorrow, we want to get vaccinated. Please do so.
Okay. What about side effects? Because a lot of people are concerned and hesitant about the side effects. Am I getting COVID when I get it? Am I going to get sick? And of course, we've heard of maybe one or two cases, and though I know it's not been confirmed, that somebody passed away.
Well, what about all the people that have passed away because of COVID, because they got infected and they couldn't battle that virus? What happened? The symptoms that we get with the vaccine are minimal compared to the symptoms or the risk of having COVID virus. Maybe a little bit of soreness on your arm, maybe headache, probably a little fever, but those symptoms don't last but 1 or 2 days. I'd rather to have those than get the horrible symptoms or uh, uh, problems with COVID, like being intubated. I don't want that. Being in the hospital for long periods of time, that is terrible. I rather my vaccine. People may be asking why that vaccine has been developed this fast. Science moves fast. And we know this is a good vaccine for everybody.
Okay. You know, I was going to ask Terrence, because he has had his vaccine, I have had mine. So what were your side effects for folks to understand what, some people do, what they go through?
The only side effect that I had was just a little soreness in my arm. And I didn't even have that until the next day, until the day after I actually received the first shot. But beyond that, I really didn't have too much of an effect.
Mm-hmm. I got a lot of fatigue, and I didn't realize it was related until later. I was like, wow, I'm so tired. But I worked right through it. I actually had a gathering I had to put together, and the next day I was like super tired. But somebody said, oh, you did have the vaccine. It's like, oh.
Right.
Okay.
Well, so speaking of the various symptoms that people experience, and when you look at, it's kind of could potentially cause like a bit of a fear factor for various communities. I know, like with the African American community, the Latino community, there's a bit of a trust factor. So how do we communicate the advocacy of going out to go get the vaccination? And overcome certain barriers such as language barriers and education.
Well, with the fear factor that is prevalent in those communities that you mentioned, what we need to do is education, going to them, explaining to them what are the symptoms that they are going to get with the vaccine. And it's easy, like you did. You show your arm, you have soreness. Kelly, she said that she had fatigue and a little bit of pain in her arm. Me too, I had my vaccine. And I was surprised, a little bit of soreness, a little bit of headache, nothing else. Fatigue a little bit, but nothing that is really major. Problematic is COVID. That is what we have to be aware of. If we get COVID, that is going to be very difficult because we are going to be experiencing those really bad symptoms, even being intubated, possible. And we don't want that. Therefore, what we need to do is educate the community, going to churches, talking to our friends, very easy, and being an example. If you are an example, you can make other people understand. We cannot make everybody to do it. We cannot obligate nobody to take the vaccine, but we can be a good example for them, and probably they are going to understand that is more beneficial than is not. We want to go back to normal. We want to be able to be with our friends, even to hug each other. My culture, the Hispanic population, we like to hug each other. Even we like to give a greetings with a kiss on the cheek. And that has been gone for one solid year. We want to be able to gather together and be family, be like family. But we have to advocate and show them there is nothing to fear about. Even what is the percentage of people that have died with the injection, with the vaccine? None. With people sick, a lot. We don't want that to happen. That is the answer.
So if people have questions about getting the vaccine, or if they're looking or targeting resources, where can they go to get information about the vaccinations?
If they want to get the vaccine, they have to make the appointment with our shot.in.gov. The people that we were talking about prior, they are diabetic people, they have cancer. They should call 211 to make their appointment.
Okay, sounds very good. Well, we appreciate you so much coming on and enlightening us and helping our viewers through this recovery, because that's the way we look at it. It is the beginning of a new beginning. So
yes,
yeah. So
it is. But we have in Marion County only, we have 53 locations offering the vaccine. And with the ages lowering down to 50 and going even lower, probably there are going to be a lot of people in line getting the vaccine. Take advantage of this moment. Call, make your appointment, and go and get your vaccine. Be one of the first ones. I got it. My husband got it. My mom is 90 years old. She has her appointment, and she's going to get the Johnson & Johnson Janssen vaccine. She selected that one, and that is perfect because we have those three kind of vaccine available in the market. Therefore, just take whatever is available near you. You can select where you want to go. You can have the Pfizer, Moderna, or Johnson & Johnson. And all of them are as good as the other one.
okay, sounds good. And again, you can go to ourshot.in.gov or call 211 to find out where to go. If you have any other questions, you can pose those at that time. We appreciate you so much, Marjorie Duarte Sheffield, who is a health educator. Thanks so much for joining us.
Thank you so much for having me. I love doing this because I want for the community to be informed. And one suggestion, get the information from the right sources. If you don't know it, go to cdc.gov and get the information from there. CDC. or call the health department, 221-2000, and get information from the right sources. Don't get it from Facebook, from Instagram, from the friend of the friend of the friend, from the right source, and get your vaccine that is going to protect you.
All right. Okay. Thank you so much. We appreciate you.
Thank you. Take care.
Bye-bye.
Thank you.
And thank you for joining us. I'm Kelly Vaughn.
And I'm Terrence White.
We'll see you next time. Bye-bye.
During the COVID-19 emergency, community action agencies are open and here to ensure the well-being of families across the country. For over 50 years, we've been delivering life-changing services, solutions, and stability.
Serving Boone, Hamilton, Hendricks, and Marion counties, be sure to visit our website to learn about employment and education opportunities, food, housing, transportation assistance, and more. Apply today by calling 317-396-1800.
The COVID-19 vaccines can be our chance to get back to our plans, who we are, what we miss, to get back to each other, to life. But it's okay to have questions, like, how were the vaccines tested? In rigorous clinical trials among adults of diverse backgrounds. Can the vaccines give you COVID-19? You cannot get COVID-19 from a vaccine. Why should I get vaccinated? Protecting yourself also helps protect the people around you. Find the latest information at getvaccineanswers.org.